What's up, y'all? It is Dr. Mia, your B3 specialist and board certified gynecologist at Me Bella Wellness Center, where we offer gynecology, weight management, hormone pellet therapy, laser hair removal, total wellness solutions, and intimacy solutions for men and women, which we will be discussing today. Our goal at Me Bella is to help you live well, age well, and experience everlasting intimacy. So, as we age and mature, so many things change about our body. First of all, we notice a change in hormones, which we talk about all the time. Hormonal changes can cause symptoms that can definitely negatively affect your quality of life. Those symptoms include night sweats, problems with sleep, decreased libido, decreased enjoyment of intercourse, difficulty reaching an orgasm during intercourse, fatigue, joint pain, belly fat, mood changes, mind fog, hot flashes, and vaginal dryness. So as we age and mature, even before we actually get into what we consider true menopause, meaning true menopause is when you've gone a whole year without a cycle. You're usually in your 50s. The average age is about 51.2. If you had a hysterectomy, it's when you start noticing some of the symptoms. We check your blood work and it shows that you're no longer producing estrogen. Perimenopause is when you're not producing testosterone, and that can start in your 30s and 40s. Postmenopausal women tend to be in their 50s or over. However, there is this new phenomenon of women going into what we call premature ovarian failure. And unfortunately, I am seeing women go into menopause at a much earlier age now. However, typically around 51 to 52, once you've gone a whole year without cycles, if you still have a uterus. If you don't have a uterus, you tend to notice some of the other symptoms that I just described. We check your blood work and confirm where you are. Regardless, we get good blood work so that we can know where your hormone levels lie. So we can fix the hormones by balancing your hormones with plant-based bioidentical hormone pellet therapy, which is my favorite, or plant-based bioidentical hormone cream, which to me is better than not doing anything, and it is definitely more affordable. The pellets are going to be more individualized for you specifically. The creams, we kind of start at a generic low, slowly go up. Regardless of which one you choose to use, you're definitely going to feel better than without doing anything if you need hormonal balance based on your labs, your symptoms, your age, and all those other things. So the other thing that can happen is we can balance your hormones. However, as you continue to age and mature, the vaginal tissue for women can change, and for men, erections can change. So as a result, we have some wonderful intimacy procedures to ensure that you don't have to suffer and that you can continue to live well, age well, and experience everlasting intimacy, but intimacy at the level that you enjoy. So one of the first things that I recommend for my patients is to start treating the vaginal tissue topically. So using an insertion either every night or twice a week at night. For many people who are starting where they're already having problems with the dryness, they're noticing sometimes a little bit of bleeding with touch, or they're noticing that they don't have a lot of sensitivity and they're not enjoying intercourse. And for some women, it's actually painful. So the first step is to start treating the vaginal tissue topically with either a vaginal estrogen, a vaginal DHEA. Those two are going to be prescription medications. And then we also have a vaginal hyaluronic acid, which you can actually order offline. Again, initially, if you're having significant symptoms, using something every night for a couple of weeks is going to make a difference. And then going to that 2 times a week at night, right before bedtime. You don't want to put the topical treatments in prior to intercourse. You actually want to put them in when you're not having intercourse so that your vaginal tissue works better during intercourse and you're less likely to need a lubricant. If you get to the point where that's not enough, you can still have other procedures that will definitely improve your enjoyment and your performance. So one of those would be the O-Wave. The O-Wave is where we take sound wave technology. It's a little probe. We put baby oil, and then we're going to use that probe to increase the blood flow on the pelvic floor area, as well as around the labia, around the clitoris. So that takes about 10 to 15 minutes. Is not painful at all. You may notice some mild discomfort, but most people don't complain of pain. It's not painful for me at all. We do have different settings, so we can go higher. If it is uncomfortable, we can go lower. And again, you then sit under the red light. Red light increases blood flow, and we sit your genital area right under the red light for a few minutes, and then you can do that once a month or every 2 to 4 weeks, depending on how significant your symptoms are. We always do that procedure regardless of whether we're doing if we're doing an O shot or the hydrogel. So for women, the O shot is where we take your blood and we spin it. We spin off all the great growth factors and everything. And that's what we use to place around your clitoris as well as in your G-spot after numbing you. So we do a topical numbing for a few minutes, at least 20 to 30 minutes. And then after that, we do a clitoral block, which is lidocaine with a small needle. You usually don't feel much of that because we put the topical on. Everybody's pain tolerance is different. Everybody, has a different experience, but most women tolerate the procedure just fine. So then we have that platelet-rich plasma, which we can also add hydrogel to. Hydrogel is made from the Wharton's jelly of the placenta. It's going to be better growth factors than the one we get from your blood alone. So adding that hydrogel to the O shot is going to just give you a more intense and improved outcome. Those changes and improvements will include vaginal lubrication, vaginal tightening, meaning if you feel like things are more lax and you have less sensitivity, you're going to feel the sensation of tightening, when in actuality, it's just increased the sensitivity of the tissue. It's also going to help with leakage of urine with coughing, sneezing, jumping, laughing. It's also going to help with urgency and frequency most people notice an improvement in that. And then it's going to improve your orgasms. It's going to make it easier for you to have orgasms. They're going to be more intense and they're going to be more frequent. So those are going to be the benefits of the intimacy procedures. Most women are going to need those procedures once a year. I usually get mine anywhere from every 12 to 18 months. And then on top of that, we also have a VFit. The VFit is a device that you can start with. After treating the topical tissue, it's a device that has red light energy, as well as a little bit of heated energy like radio frequency. And that is going to help improve the vaginal tissue. You can use that up to every other day. And then you're going to notice an improvement in your sensation, in your lubrication, in your tightening. And it also helps with urinary symptoms. So there are ways that as we age, we can continue to improve our vaginal tissue so that we can continue to have strong, consistent orgasms until we die. Many of the procedures are going to require, maintenance treatments. So again, once a year, for some of my patients like me, for example, I try to get an O-wave as frequently as I can, but of course I work there, so it's hard to get things done. But my patients who really do well probably get 3 to 4 O-waves a year along with the O-shot and the hydrogel, and they're probably already on hormone replacement therapy, including testosterone, because the testosterone is very important for orgasms and for enjoyment. Estrogen, topically or systemically, is important for the vaginal tissue. And remember, we're not just treating the vaginal tissue for sexual purposes only. It's also very important. So if you have an elderly parent that you're taking care of, they keep getting urinary tract infections. One of the easiest ways to treat that is to allow them to either take a medicine by mouth every day that helps with the vaginal tissue, or to topically treat the vaginal tissue by placing an insert like the hyaluronic acid, the DHEA, or the vaginal estrogen. And it actually prevents urinary tract infections and improves some urinary symptoms, and also decreases the risk of having prolapse in the future, like cystocele or rectocele. Cystocele is when the bladder starts to fall down. Rectocele is when the rectum starts to fall down. And those things can affect your function as far as your bladder and as far as your bowels. However, starting to treat that tissue at 40, and if you're on birth control even earlier, makes a huge improvement in how your tissue ages. So if you want an ageless vajayjay, it is necessary to do those treatments just like we do for our face. We have this skin regimen for our face. It's important to have that regimen for your vaginal tissue, which includes topical treatments, which includes the O-wave on a regular basis for some women, which can include the O-shot as well as hydrogel therapy. And those things are going to definitely improve your sexual function and also decrease urinary symptoms like stress incontinence, which is the leakage of urine with coughing, sneezing, jumping, laughing, as well as some urgency and frequency symptoms. And it will definitely improve your sexual function so that you can enjoy intimacy until you die. So Other important things for the pelvic floor and maintaining good, healthy tissue and for the pelvic floor is exercise. So doing your Pilates, and there are definitely some exercises that you can do to help strengthen the pelvic floor. There are also some devices that can be used to help strengthen the pelvic floor. And again, we talked about that VFit, which can also help to improve the vaginal tissue and decrease urinary symptoms. So the good news is that as we age and mature, there are definitely some preventive strategies that we can use to improve our vaginal tissue so that we can enjoy intimacy forever. And those, again, vaginal treatments are going to be topical, as well as some great procedures that we have that you can do on a regular basis, anywhere from every 12 to 18 months for the actual O shot and hydrogel for women. You could do the hydrogel a little bit more frequently, but most women don't need it over, sooner than the 12 to 18 months. However, that O-wave is something that you can do on a regular basis, every other month, every month, depending on what your symptoms are like and how severe your symptoms are. Again, anytime we're talking about intimacy and everlasting intimacy, is definitely important for you to always focus on your health, making sure you're doing your preventive strategies, as well as making sure that you are going to the doctor, getting your screenings, maintaining a healthy weight, living a healthy lifestyle. Exercise is going to be key for aging well. It's also going to be key for great sexual function. Pilates is perfect because it helps with your stretching and your flexibility. And it also, there are so many great Pilates exercises that you can do for your pelvic floor, which will help decrease urinary symptoms and improve function, because you'll have better control of those muscles in the pelvic floor, which help enhance enjoyment during intercourse. So it is Dr. Mia, your B3 specialist and board certified gynecologist. I help men and women suffering with weight gain, fatigue, and sexual dissatisfaction improve their quality of life through our cutting edge procedures at Mibella Wellness Center, which include weight management, hormone pellet therapy, intimacy services, total wellness with supplements, as well as laser hair removal. Of course, at Mibella Wellness Center, we offer gynecology to women and adolescents, and we are very proud of the kind of medicine that we practice and how well we take care of our patients at Mibella. So if you need your prevention and your screening, go ahead and schedule your appointment. Make sure you're getting that annual exam with your gynecologist once a year. And if you're over 65, you can push it out to every 2 years. If you've had a hysterectomy, you can push it out as well. But I feel like if you're younger, you're under 50, under 60, you should still be getting those exams every single year, because your gynecology exam is not just to prevent cervical cancer and to help with those GYN issues. It's also to make sure that you maintain total wellness as well as great sexual function. So it is Dr. Mia at Mibella Wellness Center. This is Weekly Wellness with Dr. Mia, where I am here to give you as much information as I can so that you can live your best life, midlife and beyond. And we're super excited about launching our Ageless Vitality podcast, which will be launching in the next coming weeks or next couple of months, and we'll keep you posted. So look out for that so that you can subscribe to our podcast, where we will focus on living your best life in the midlife and beyond. It's Dr. Mia. I hope you have an amazing weekend. Go live well, age well, and experience everlasting intimacy. If you need to get in touch with us, you can always go to mibellawellness.com. Actually, I was going on vacation this week, but I'm not now, so I have a lot of openings. So if you need to schedule your appointment, or you're one of my friends or the people that I know that are out and they're always saying that they can't get an appointment, they can't get an appointment with Dr. Mia, this is a good time to go on the website, schedule your appointment, because I do have some openings, because I was supposed to be out of town this week. I changed my mind. I will be here to take care of you. So schedule your appointment so I can help you live your best life. It's Dr. Mia. Y'all have a great Saturday. Bye. And don't forget to join us tomorrow at 8:30 p.m. on Ageless Intimacy with Dr. Mia and Joseph, where we will be talking about intimacy and wellness or something like that. So just join. It'll be great information. Love you guys. Go have a phenomenal weekend. Bye.